Hello, and welcome to NANNcast. I'm Jill, your host. With so many shifts happening in vaccine recommendations, have you ever wondered how to navigate those conversations with parents in a way that stays grounded in science and builds trust at the bedside? With recent changes and national recommendations and a lot of mixed messaging circulating right now, many families are asking more questions than ever about the Hep B vaccine, the routine immunization schedule, and how vaccines actually work in their baby's developing immune system. As neonatal nurses and advanced practice providers, we play an essential role in these conversations, and staying grounded in science and trust has never been more important. Today, we're joined by two experts who not only lead in their fields, but also have a remarkable ability to help clinicians approach vaccine discussions with clarity, confidence, and compassion. First, Dr. Aimee Bernard, Associate Professor of Immunology and Microbiology at the University of Colorado and co-director of the Colorado Clinical and Translational Science Institute, Communicating Your Science to the Public series, and is nationally recognized pro-science, pro-vaccine voice. And we're also joined by Dr. David Higgins, pediatrician, preventative medicine specialist, and assistant professor at the University of Colorado School of Medicine. David's work focuses on vaccine delivery, communication, and building vaccine confidence, and his insights have been featured everywhere, from the New York Times to the Washington Post. He also serves as vice president of the Colorado chapter of the AAP and sits on the board of directors for Immunize Colorado. Together, we'll talk about navigating vaccine conversations with families, the importance of the hepatitis B vaccine at birth, how to respond to too many too soon concerns, and how neonatal nurses can lead with evidence, empathy, and trust. Let's get right into it. Thank you for joining us today. I think we can all agree that vaccines in the NICU aren't just a medical decision. They're a very emotional moment and decision for families. So, David, in the NICU, vaccine discussions happen when families are so overwhelmed. They're dealing with so much information, their critically ill child, and a parent sometimes can react with hesitancy or uncertainty when we have a discussion about vaccines because they're processing so much. How do you approach those first vaccine conversations in a way that feels safe and supportive rather than pressured?
Yeah, well, I think the first thing that you have to do is recognize what you just said, that the family's feeling overwhelmed. I mean, being a new parent is overwhelming no matter what. And even me, I became a new parent after becoming a pediatrician, and it was still overwhelming. And my baby wasn't in the NICU. And so you have a parent who's overwhelmed by having a newborn and having them in the NICU for whatever reason they're there. And sometimes they are really critically ill and they are making decisions and learning about really high pressure things every single day related to their child's health. And so then you introduce vaccines into that milieu. And it's so important to recognize where the parent's at because you want to enter the conversation about vaccines with a lot of empathy and understanding and compassion for where they're at in the moment. If you enter the conversation and the parent immediately feels like you're pressuring them, immediately feels like, you in some way are shaming them for having hesitancy or having concerns, that's going to backfire. The conversation has to be built on partnership with the family and having some empathy and understanding where they're at and what they're going through. And NICU nurses understand that better than anyone.
Yeah, I think what you're describing is more of a relational conversation, not a transactional conversation. Like, I'm here to tell you that you need to give your child this vaccine, but to understand, I guess, where they're coming from and trying to build that trust.
Yeah, exactly. And I do say it's really important that you make your recommendation clear, right? The overwhelming evidence is clear that these vaccines will protect the child, right? So it's important that you are clear with your recommendation, but you can do that in a way that still invites partnership and in an empathetic way, right? You can both say, I think it's really important that your baby get these vaccines to protect them, to keep them healthy. And if the parent shows hesitancy, if they say, oh, no, I'm not sure about this, I'm worried, that's when you follow up with, do you mind sharing with me why you're concerned today? Do you mind telling me a little bit more about that? Open up that conversation and invite them into a partnership about it when they're concerned. Because you also will run into families who are very accepting and don't have a lot of concerns. That happens too, right? Still, most parents choose to vaccinate their children. And so when that happens, you can continue to go along with the rest of their care.
So, Aimee, you come at this from more of the science communication side, and you spent so much of your time helping clinicians communicate science in a more human language. So when parents are hesitant, and I guess you could say their hesitation comes from more of like fear and sort of distrust, but also all of the influences of the misinformation that's out there now. What strategies do you use that can help you connect and communicate effectively?
Yeah, I would echo what David says when you're talking to parents, in the NICU or in the clinic. I think that parents, whether their kiddos are in the NICU or, it's a neighbor or a friend or an acquaintance or even a stranger that's asking questions about vaccines, they're just using the information that they've read or heard. And like you mentioned, some of that will be misinformation or things that are not accurate that they've seen on websites or TVs or, heard from, anecdotes that they've heard from people. And it's just important to understand that they're just using the information that they have to try to make the best decisions for themselves and their families. And unfortunately, sometimes those are misguided by, some of this, inaccurate information. But I would say the thing that has comes, again and again that makes for these kind of successful conversations is listening to people, connecting with them, trying to find common ground. Like often I will say, I can understand why you have questions. If I was not an immunologist who really understood how the immune system works, I would also have questions about, things for my kiddos. So I think we just need to meet people where they're at and try to answer their questions and listen and make connections, find common ground. And then I wanted to add, I have 21-year-old twins, but they started their first 3 weeks in the NICU. Which was scary. They came out at about, I think it was 35 weeks. My husband is a pediatrician, and he would say 34 weeks because they were 34 weeks and 6 days.
Still 34
But as someone who likes to round up and who carried them, I say 35. But either way, they spent their first 3 weeks in the NICU because they were little. And that was overwhelming. And my husband was also a pediatrician at that time, an early one, a resident. But it's a lot of scary decisions. They're hooked up to all these tubes and they're in these incubators and there's just a lot going on. And, obviously as the two of us, we were like, of course, give them whatever vaccines and vitamin K and everything else that they would need to, stay healthy and protected. But it is an overwhelming time. And I can see where people would have, questions, and it would just add to the anxiety you have about being a parent, just being in the NICU and not being home with your babies. And then I did want to add in a really fun story if it's okay. One of the NICU nurses who took care of them the whole time and was, I think, the one that was mostly in charge of the two of them while they were there, at the very end gave us quilts that she had made for the two of them, which I was completely awestruck by that because who would have thought she would have time in her spare time on the evenings and weekends or whatever to make quilts for two babies? And she said she does that for all the babies she takes care of. So that was just really touching, and we still have them. And my kids, I'm sure, will take them with them down the road to their future homes. And so it was just really heartwarming. So I just wanted to put a thank you out into the universe to all the NICU nurses out there.
I love that. Thank you for sharing that story. We oftentimes think we're forgotten after we spend so many months or whatever in the NICU. And to hear that those pieces are still kept so close to the family is really nice to know.
Yeah.
So.
Yeah. Thank you.
And I love how, we're talking more about leading with empathy rather than just like, here's the evidence, you must give this vaccine. And, nurses are at the bedside all the time and they're with the parents so they can understand what are their fears, what are their questions, why are they hesitant. So, as nurses, you need to make sure that you're explaining this to the provider. So when they come in to talk about it, we're all on the same page. And, we're able to effectively communicate more so, like you said, with empathy and find out where the families are coming from.
Yeah, I think that's so important. I'm jealous of you all sometimes in your vaccine conversations because now I practice in a pediatric primary care clinic where I have 15-minute appointments, right? And the amount of time I have with families is small. And sure, I can see families multiple times, obviously, as I continue to care for their child as they're growing up. But you have this unique opportunity to continue to have this conversation if the families continue to be hesitant or have concerns, to continue to have that conversation over sometimes weeks, sometimes months. And that's a unique opportunity that you have. You also get the opportunity, more than even the pediatrician does at birth, to quickly build trust and rapport and a relationship with the family, right? And for a general pediatrician, that often takes some time if it's the first time seeing the family because, we see them in these short little visits over time. And sure, in the first year, there are quite a few visits, but you have the opportunity right from the start to build that quickly.
Yeah, and I think sometimes we have to switch the way of thinking when talking about vaccines. Like, it's not just like, oh, we won that conversation. Like, the parents agreed to those vaccines, but how can we keep that door open to allow those conversations with the families beyond that initial conversation that we have when we're introducing vaccines? So maybe they want to think about it, and then they come back with more questions. Like, we want to harvest that kind of relationship where they feel comfortable continuing to talk about it.
That's really important. Don't close the door on the conversation if the family is showing you that they're hesitant. If they say, no, we don't want to do those, don't completely close the door, because the truth is, we know this, that most parents have some ambivalence. They're uncertain. And I don't blame them. Just like Aimee said earlier, right? Parents, especially new parents, are overwhelmed with information in their parent groups, pre-parent groups, in their neighborhood, social media. Like, they are just getting bombarded with stuff. And then you get the really eager ones, and I was one too, that read all the books. And, they go out and they seek it all. But even if they're not, they're just bombarded with information. And so it's understandable that they are a little bit confused. They've heard all sorts of different sometimes conflicting things about vaccines. So even if it seems like a parent and caregiver is not interested in vaccinating, understand that most of them still are somewhere in the middle. Sure, they have concerns and questions, but they're very much movable one way or the other. It just sometimes takes some time.
Yeah, and I think, like you said, bombarded with information. And, one of the first conversations that happens after your baby's delivered is, do you want the hepatitis B vaccine? And that's the first major decision that they have to make once their child is delivered. And that happens either in the NICU or in the delivery room. And it's sort of the parents' first, I want to say, big decision for their baby. David, can you walk us through that part of the discussion? Why do we recommend Hep B at birth? And what are some of the risks that we have if we decide to hold off on those vaccines?
Yeah. So the reason why we recommend all babies get the hepatitis B vaccine at birth is because the vaccine protects against hepatitis B infection, which is an infection of the liver that causes liver damage and ultimately cancer. So the hepatitis B vaccine actually prevents cancer. And here's the deal with the hepatitis B virus. It is really, really easily transmitted. So it's super infectious during birth. Okay, so the baby during birth is very likely to get it if mom is infected with hepatitis B. And unfortunately, they're also very likely to develop chronic infection, again, causing liver damage and eventually liver cancer. So the hepatitis B vaccine, when given at birth in the first 24 hours, has been shown to reduce the chance that that would happen, reduce the chance that the baby would get infected and then have those serious consequences by 70 to 90%. So it's incredibly effective at doing that. And we like to think of the hepatitis B birth dose as a safety net. Okay, we also test moms during pregnancy for whether they are infected with hepatitis B. But the tests aren't perfect. They're not always done in the proper way. They're not always interpreted properly. And moms can become infected with hepatitis B after their test is done, because the first test is usually done at that first visit, which happens around 8 weeks. And so for all of those reasons, and because we don't want to take any risk, even one child who could have been protected falling through the cracks, for that reason, we recommend it for all babies at birth to prevent it. And it's an incredibly safe vaccine that babies can get within the first 24 hours.
I know right now hepatitis B is kind of a hot topic. It's been in the news lately. What are some of the myths and misunderstandings about Hep B that you've encountered, and how do you clarify them?
Yeah, so some of the biggest that I see is first that the only way you can get hepatitis B is through sexual activity or IV drug use. And I've seen this myth spread all over the place. That is not why we are recommending it at birth. We recommend it at birth because babies can get it at birth. The other myth, the other part of this myth is that even after birth, children, young infants and children can get hepatitis B through exposure to someone in the house or a caregiver or someone, a daycare worker, someone like that. It is a very infectious virus, and it's a hardy virus in that it lasts on surfaces for a very long time. So those of us that are parents know kids have bleeding episodes, right? They have bloody noses, they skin their knees, all sorts of things like that happen. And that puts them at risk for getting hepatitis B from a fairly benign exposure if they're not vaccinated. So that's probably one of the biggest myths that I hear. And it's really important for people to understand why we recommend it at birth. It's not only to protect them from getting it through the birthing process, but also as an infant and toddler and young child, because they're still going to potentially be exposed to it.
David, thank you for giving those points for us, because it's really important for nurses to have those answers for those questions when parents are asking them, especially when, we're getting consent and we're administering. We want to be confident in what we're saying to those parents. So thank you for that. To really explain why vaccines matter, we have to understand what the infant immune system can handle, because that's really the heart of the parent's concern. Like, they're in the NICU. Can they really get these vaccines? Aimee, this is your world. So can you walk us through what actually happening immunologically when we vaccinate a newborn or young infant? And how is the newborn's immune system designed to respond safely, even to multiple vaccines?
Yeah, that's a great question, and I get that all the time. I think probably the catchphrase for that is "too many, too soon" is what you hear in, vaccine skeptical or vaccine hesitant circles. The beauty of the immune system, whether you're a newborn or a toddler, child, teenager, adult, the immune system is designed to handle billions upon billions of pathogens that or anything that we encounter, anything that comes our way. So our immune system is a collection of cells, a lot of different cells in our body that work to protect us. And like I said, we have billions of them. And what's interesting I find it interesting as an immunologist, but what's interesting is that we have these specialist cells in our immune system their names are B cells and T cells, but they're specialists. I like to think of them as like the special forces. And each of these cells has its own unique specialty, like the pathogen or thing that it's specific for. So we might have a few B cells in our body, these specialists, these special forces that are kind of designed to combat like SARS-CoV-2, the virus that causes COVID, and maybe a few more that are designed to combat influenza, and you can think of that because we have billions. We have cells that would potentially be able to respond to and target any pathogen that comes our way. So what happens is when you're exposed to the influenza virus, whether it's out in the wild, like you inhaled air from someone who coughed at the grocery store or like a soccer game or something, or if you're getting a harmless version of that virus in the vaccine that's, injected into your arm, only the immune cells that are built to target that particular pathogen, like that influenza virus, will actually respond. So all the other billions of cells that are built for something else, they're just kind of hanging out and chilling and just waiting for their own pathogen to walk into your nasal cavity or be inhaled or whatever. So the majority of your immune system does not respond to any pathogen. It's just the cells that were designed for or have specificity, or their specialty is like influenza, as an example. So the immune system cannot be overwhelmed as a result because of this specialty that we have built in. So I'd like to give another analogy that I use when I teach my medical students, if that's okay, because this works, I think, pretty well. So imagine that you are having a heart attack and you go to this really big hospital that has, all kinds of specialists in the hospital. Well, when you walk in the door and you tell the triage in the emergency room that you're having chest pain, they think you have a heart attack, they're going to send you to the cardiologist, because the cardiologist is the specialist that is going to respond to any heart problems, right? I'm not going to see the neurologist, like the brain doctor. I'm not going to see the hematologist, the blood. I'm not going to see the other specialists. You're going to go see the heart doctor. So that's the exact same thing happens when any pathogen enters our body. The specialist, the immune cell specialist that is built for, that targets that particular pathogen, will respond. But all the other specialists will just kind of, hang out and wait until their pathogen comes in. So that's, I think, the way that I like to explain the immune system is that we have specialization built in so that we can handle anything. And our immune system is incredible in the sense that we have cells that could recognize anything that comes our way. So does that help describe, I guess, the kind of how you cannot overwhelm the immune system?
Yeah, that was such a clear way to put it.
Yeah, I've had some feedback from medical students over the years that has worked fairly well with when they're talking to some, because they all do clinical rotations and clinical experiences, and that has worked pretty well. So then just to kind of further that, when babies are given, according to the recommended immunization schedule, when they're given multiple vaccines at one time that would contain, harmless bits of the pathogen, like, the DTaP is, so the DTaP for kids, diphtheria, tetanus, and acellular pertussis, that's, 3 pathogens in one. Only the specialist cells are going to respond, the diphtheria specialists, the tetanus specialists, and the acellular or the pertussis specialists. So you're still only going to activate a few, a handful of immune cells that are going to respond. And if they're even given, other vaccines at that same time, again, it's only those cells that have that kind of built-in specialty for those pathogens that will respond. And then another thing I wanted to mention is the reason why we want people to get vaccinated, which, of course, as immunologists and pediatricians and nurses, we all know, but just to make sure everyone out there is understanding, it's to train the immune system. You train those specialist cells, And another beautiful thing is they will turn into what we call memory cells. So these memory cells, just like they sound, will remember the pathogen. So you're training your immune cells to become memory. And memory cells, we know, can circulate in your blood for the rest of your life. So what that means is when you've trained these cells, if you come into contact with the real thing, like I said, out in the wild, like grocery store, soccer games, school, whatever, your memory cells are going to be there, and memory cells are really quick to respond. So they'll just like immediately respond to the pathogen that comes their way. And as a result, we often encounter pathogens that we have seen in the past, whether it was out in the wild, like through infection, or through guided immunity, like a vaccine. And our memory cells respond so quickly, we don't even know that we've encountered the pathogen. It just responds and takes care of the infection. So it's building that memory is what's really important. And the more vaccines that you get according to the schedule, the more memory that will be built into the system to help those kiddos be protected, for a very long time.
Thank you for translating that into everyday language, because it'll be so helpful for nurses to explain this to parents in a language that they can understand, and also to make sure that we feel confident as nurses or advanced practice providers at the bedside to be able to explain this to parents in a way that they can understand. Why add any more overwhelming facts to them if we could explain it in more simple, easy to understand, easy to digest terms?
Yeah, thanks. As you can tell, I enjoy coming up with analogies.
No, it's perfect. We love that. And then David, from like a clinical standpoint, Aimee mentioned it briefly, but can you expand on why the vaccine schedule is spaced the way it is and what goes into those decisions as to why we time them in a certain way?
Yeah, so we have created the vaccine schedule with a lot of intentionality. The schedule is designed to optimize protection for newborns, infants, and children and adolescents at the time when they need protection the most. Okay, so any delay from the recommended schedule means that they are vulnerable during that time period when we most want them protected. The other reason that the immune schedule is built the way that it is, it gets into the immunology of it. We know that at certain ages, the immune system responds in a better way. It creates even more memory, or like Aimee said, it's trained even better if some of these vaccines are given at certain times. And so that's why the schedule is created with so much thought and intentionality to optimize protection and optimize the training of the immune system.
That helps put into perspective not just what the schedule is, because all nurses understand the schedule, but the why behind it. Because, of course, parents are going to have a question. We've all heard too much too soon, like Aimee said, but now we'll have the knowledge and the descriptions behind that now.
Can I add in one more thing to further that discussion? Another thing I like to tell parents that are, or friends, neighbors, whoever has questions about the recommended immunization schedule for kids, for infants and kids, is that, your immune system is a blank slate, more or less, when you're born. Like, your immune system is just coming on board just like every other organ system in your body. So your immune system has not built any defenses yet. It has not been exposed to anything out in the world, because this is a baby that's just inside of, the pregnant parent. So building up immunity through vaccination provides a way that's safe and effective for that baby to build immunity and memory, so that, when they encounter it out, on the playground or at the childcare or, in your grandparents' home or wherever it is, they're going to have that protection. So you're helping to build the baby's immune system in a safe and effective way by giving those vaccines when recommended. The other thing I will mention that helps provide protection to the baby is that when mom, pregnant parent, immunoglobulins or antibodies can cross the placenta and can provide protection for a few months in the first few years of life. And that's why some of these vaccines are recommended during pregnancy, usually a little bit later in pregnancy. So the antibodies will be produced in like the, third trimester and then cross the placenta into the baby and have, as long as a period as possible to be in the baby's blood and provide protection. But what's important is during that time when the antibodies that have crossed placenta from mom to baby are on board, but before the baby's been exposed, those antibodies will provide a couple of months protection, but it's great to give those recommended immunizations in that time to help build the immunity while there's a little bit of protection from mom and those antibodies. And then once those antibodies, they're just proteins, they're going to degrade after, 3 to 6 months. It's great when baby will start to make, their own antibodies as a result of these immunizations. So that's another really important aspect to consider. Is I like to say that it's the first thing you can do as a mama bear is even before they come out. you can get some of those immunizations so the antibodies will cross into the baby and provide, it's the first defensive, thing you can do to protect your baby is to get those recommended immunizations during pregnancy.
That's a really good point that you brought up because we do have parents, moms that say, I received the DTaP vaccine when I was pregnant or so my baby doesn't need that. But it's important to understand how that works and how we still need to continue with the schedule for the baby, even though you did have that vaccine.
Yeah.
Yeah, absolutely. And, I want to add to this. One of the other ways that you can protect your baby is by making sure you and others that are going to see your baby are vaccinated as well against things like whooping cough, pertussis, influenza. Okay. Those types of illnesses are incredibly dangerous in a newborn, especially a preemie. And if you and the caregivers and people that are going to spend a lot of time around your baby are vaccinated, then it's less likely that they are going to be exposed to those viruses.
Excellent point, too. I think we try to drive that home when we're discharging babies, especially the importance of other caregivers that are going to be taking care of their baby. But it's also important to keep that in the back of your mind and make sure that it's out there because sometimes those things kind of fall behind because we're so focused on the baby's care at discharge that we sort of forget.
Yeah, it's easy to forget. And siblings too, because the second that baby goes home, the older sibling is going to just snot and drool all over the baby. So making sure that they're up to date on their vaccines is equally important.
They live in a little bubble in the NICU, but that bubble bursts the second they leave the
go
NICU
home.
doors. Yeah.
Yep.
So let's talk about where families get their information, because we all know the second we leave the room, they're on Dr. Google, they're on social media, and unfortunately they find sites that aren't evidence-based, that are filled with a lot of misinformation. David, what are some of your go-to resources for accurate, parent-friendly vaccine information that's written in a way that they can understand?
Yeah, good question. So I usually send parents to one of several places. One is the American Academy of Pediatrics, and healthychildren.org is really their parent-facing resource for everything, really all sorts of preventative care and child health topics, but they have a great sections on immunizations. And that's probably the first place I send families. Sometimes families are interested in a little bit more detailed information and they really want to get into the weeds, in which case I'll send them somewhere like immunize.org has really great information that can be a little bit more detailed, as well as the Children's Hospital of Philadelphia. They have the Vaccine Education Center. And that's for families that, maybe they have a specific question, like what about aluminum in vaccines? Or what I've heard about thimerosal, and these little things they pick up on, and they maybe want a little more information. I often send them to those places. The only other places I want to mention is there are several different websites that have really good information, and they're a little less data heavy. They don't seem to come from some type of a institution or academic center, and that's places like Vaccinate Your Family. or voicesforvaccines.org. Those are the most common places that I will send families that are interested in learning more information from a credible and reliable source.
So you say credible and reliable source. How do we teach parents that a source is credible or trustworthy? Because I've had parents say to me, "Oh, I read that on Reddit," and it's like, Reddit's not the best source for that. But like, how do you explain to parents how they can determine what is a reliable source?
Oh, such a good question. So when I first started seeing patients and practicing, my message to families was kind of like, well, don't look online. You can't trust anything online. And over the years, I've quickly realized, look, families are going to go do their own research, and that's okay. I don't make them feel bad for doing that. I do the same thing when something's like broken on my car. I go doing my own research, even though I'm definitely not an auto mechanic. So it's fine for them to do that. But I give them some guardrails, right? I know they're going to go looking. And hey, even if they're not looking, they're going to be swiping through their favorite social media app and it's going to just pop up in their face. So I give them some guardrails. I warn them and I say something like, hey, when you're online, when you are interacting on social media, you're going to see all sorts of information. Some of it's good, some of it's false, and some of it's misleading and trying to sell you on something. And it's really important that when you see something online or you see something on your social media feed, that you are stopping for a second and asking yourself, is this something I can trust? And the things to look for is that they're trying to sell you on something, they're trying to scare you into something, or they are not linking to any other credible source, right? So good, credible information will link to other good, credible sites and resources. If they're not doing that, it's likely they're not doing that because there's not anywhere to link that's a credible source. So those are some of the things I do. And then I always tell my families, I say, hey, if you see something and you're really not sure about this, send me a message. Phone into the clinic, come talk to me next time. And in the NICU, you've got, again, that advantage of having them sometimes for weeks or months at a time. And you can say, hey, if this comes up, let us know. We would love to talk to you about a concern that you saw on social media or something that you heard in a mom group or something. We would love to talk to you about that and tell you what we know and help partner with you to make sense of it.
I'll chime in really quickly too. So I actually wrote a guest commentary for this in the St. Paul Pioneer Press a couple years ago in response to a very small little brief thing I saw in the newspaper that I was very mad about because it was someone had written in and was just kind of spewing a lot of misinformation, and I was very mad that it was printed. But either way, this turned into me writing to the editor, and then the editor said, why don't you write an article about how to assess health info on the internet? So I did that. I was on the St. Paul Pioneer Press, but then I turned it into a Medium post so that anyone could access it. It's open access. But I would say I agree with everything that David said as far as sources, author references. I would also add emotion. How does it make you feel? Because evidence-based data usually it doesn't make you feel, passionate or fearful usually. So typically misinformation or things that are misleading will often induce fear or make you feel scared or angry, things like that. So I would also add check your emotions, because usually evidence-based information is not going to be emotion inducing for the most part.
I love that tidbit. That's excellent.
Yeah.
Because, a lot of parents do go to social media to find camaraderie and support amongst other NICU families. And, sometimes there is misinformation there. So to tell the parents, how did that make you feel? And that's a great way to determine if something is something that you should trust or not. So thank you.
Yeah, you're welcome. I think that helps a lot, because most of the time I'm really mad. And it's like, well, let's just start there.
Uh-huh. Yeah, because data doesn't really spark much emotion from anybody. So it is what it is. It's there.
Exactly. Yeah.
All right. So before we wrap up, I'd love for our listeners to know where they can find more info from the both of you, because we all know that this work goes well beyond our NICU doors, and you've really given us so much information. So where else can we find info from you?
For me, I do a lot of volunteer content contribution to a platform called Unbiased Science, which is pretty well known across social media. David does that as well. And I have a Substack myself. You can find me on my social media handle is kind of funny. It's at Fun Size Immuninja, like Fun Size Candy Bar, because you can't see me, but I'm an adult in a very small kids package. And then Immuninja, Immu for immunology, and then Ninja because I used to practice Taekwondo with my kids. So Fun Size Immuninja on Instagram and TikTok and places like that. But another thing I do is I write a lot of content for the Immunology Explained website. And I'm a member of the American Association of Immunologists, or the AAI Communications Committee. And as a result, I write a lot of blogs and record a lot of videos and things for Immunology Explained. And we actually redesigned the website in the last year specifically for parents who have questions about vaccines, allergies, autoimmune diseases. So Immunology Explained would be a great place for people to go. It is going to be obviously immunology kind of relevant information, but we've found that a lot of parents have questions about allergies and vaccines and just if they're concerned about their kiddo having a certain immune condition, it's a really kind of good place to get some foundational information for that.
And for me, in addition to also contributing to Unbiased Science, like Aimee said, I write a Substack called Community Immunity. And you can find me on all the socials. My handle is not nearly as exciting as Aimee's. It's just Dr. Higgins, MD. And I'm most active on Instagram, Threads, and LinkedIn.
Well, thank you for joining us today. Today really enforced that the vaccine conversations that we're having in the NICU are about building trust, translating immunology into human language that they can understand, and really just protecting our babies. So thank you for joining us today. And if anybody's interested in following and reading and following up on everything, I'll add all that information to the show notes. So thank you. Make sure you never miss an episode of NANNcast by subscribing now. This podcast is made possible by listeners like you. Thanks for your support and letting us into your ears. Have a great day.